Welcome to What to Do After the Surgery video. We start our surgeries at 9 a.m. They come to the hospital around 8 or 8:30. After file checks and blood works, they settle into their room. I come to hospital around 9. I visit the patients and I go to the surgery. If we start the surgery around 9 a.m., surgeries takes approximately 1 or 1.5 hours. We take the patient into their room afterwards. They come to themselves in an hour, and they leave the hospital around 4 p.m. This is our routine. If they leave the hospital at 4 p.m., they can fly back to their hometown at 8 or 9 p.m. They fly back with 8 or 9 p.m. flight because we consider Istanbul traffic around that hours. With the passport check, etc., they can catch the 8 or 9 p.m. flights, so we recommend them to buy a late flight ticket. We send them back with their dressing inside the underwear. The dressing should stay intact for 3 days. Since the dressing is open from the tip, they will have no difficulty when peeing. After 3 days, they take out the dressing. Sometimes they do it. When they are in the shower, you take it out. You take a shower, but you cannot shower before 3 days. Dressing should stay dry. After those, they won't need the dressing again. After taking a shower, they dry themselves properly. I also recommend to dry the area with paper towel, and they should leave it open. Then they can wear their underwear and clothes. Stitches will fall off 3 weeks later. We used to use stitches that falls off sooner, but when we do it, sometimes the stitches would open up a bit. Now we use the ones who falls off later. They fall off 3 weeks later and there will be no opening. I have also said you don't need to do the dressing again. We write down an antibiotic and painkiller. They finish the antibiotic in 5 days. You need to use it properly, and there is also the swimming pool and the sea issue. Well, showering is not a problem. After 3 days, because soapy water is a kind of sanitizer, we are not worried about it. Clear water is also not a problem. So you can rinse your body. For example, we also do it before the surgery. Soapy water and then clean water. You don't have any problem with those. But swimming pool and sea, you cannot swim in any of those before 2 weeks. Patients ask about it, especially in summer. We consider them dirty. It's not like the showering water. So you shouldn't swim in both of them before 2 weeks. You need to wait for 2 weeks, and it is 3 weeks for sexual intercourse. You need to wait for 3 weeks to have a sex. So these are the basic things you should do. There is also one more thing I should mention. I told you that I had a funny story about this. Pain after the surgery. When we cut the suspensory ligament, we suture them with so many stitches in order to pop the penis out. In the beginning, this can cause some pain during an erection or a sexual intercourse. I will give you a funny example. I had a patient who had come from Iraq. He came with his relatives that has been living in Turkey. We performed the penile enlargement surgery, thickening and elongation. Then we sent him back to his country. After a month, his relatives called me. They said that his penis caught an infection. I couldn't understand how, because if it had happened, it would have been in the first week. But a month passed, it is not possible after a month. But he saw an urologist in Iraq, And the doctor told him that I thought if a specialist says that there must be something wrong, and I invited him back here, so the patient came here. During the examination, I saw that there was nothing wrong with his penis, no infection or anything. So I asked him why he saw a neurologist about it. Why did you think that there was an infection? I learned that he had a sexual intercourse after a month and he felt some pain. Then he went to see a neurologist about it. When the doctor saw the penis got bigger and there was also some pain, he thought that the penis was infected. So I asked him whether he told the doctor about the penile enlargement surgery. If he had told the doctor about it, the doctor wouldn't have thought that there was anything wrong. Since he didn't tell him, the doctor thought it was infected, then he sent him back to me. So, there can be a small pain during the first couple of weeks. You should know about it. It is nothing important and it gets better. Patients get used to it after a short while, then the pain goes away. We didn't have any patient who had pain for a long time, but you can feel it for a short while. Well, since it's the genital area, will there be any infection? I didn't see any case like this. Actually, there was one case. He was a young guy from Diyarbakir. He had the operation after one day. He opened up his dressing. I didn't instruct him, so I told him to wait for 3 days, but he was curious and he did it. So, his penis got infected. He sent me a photo and there was a small patch on his penis that it looked like a pimple. I thought it was a pimple, but then a discharge started to come out of it. I asked him to come immediately because when we talked on the phone, he told me what he had done. He came here, we cleaned the abscess. He was kind of lucky because we were able to do it without losing too much fat. So please do not open the dressing before 3 days. If you take care of it well and wait for a while, you won't be having any problems because we also give you antibiotics. So please be patient for 3 days, then open it, okay? So I don't think that I will talk about it any other thing. If you have any questions, you will find the addresses and the phone numbers at the end of this video. You can reach out to me and I will try to help you, of course.